It's Dr. Glenn Davies for Reversal NZ and Reverse T2 Diabetes Taupo, coming to you from the greenhouse. So we've had a whole heap of rain, which is fantastic. So what am I going to talk to you about today? I'm going to talk to you about this number. So I know that's come out backwards for you, but 138. So 138. So what is that number? So that's the number of people that I have documented that have reversed their type 2 diabetes or pre-diabetes in Taupo. Now, I know with certainty that there are a lot more people than that, but that's just the ones that I have been able to document. So what does that actually mean? So these are people whose HbA1c has been above 50, and they have brought their HbA1c down into the pre-diabetic range, which is 41 to 49, or they've brought it down from the diabetic range down into the normal range, which is 40 or below. Now, up to 3 or 4 years ago, I do not recall seeing a single person who had reversed their diabetes or pre-diabetes. All that I saw was diabetes getting progressively worse. So all I saw was HbA1c going up and up and up, progressing towards retinopathy, which is blindness, towards peripheral vascular disease and limb amputation, and towards kidney disease and eventually dialysis. So up to 3 to 4 years ago, that was what I knew about diabetes, and I just saw increasing medication and eventually the use of insulin. Now, what do I see? Now I see it being completely normal for people to present with type 2 diabetes or with pre-diabetes, and for them to normalize that and put their diabetes into remission. So that's now what I consider the aim for everyone who presents with pre-diabetes or diabetes. You know, the other part of this, the people with pre-diabetes, that was HbA1c between 41 and 49, I just saw them eventually, or at times reasonably quickly, progressing to diabetes, to medications, and eventually insulin. You know, now when I see someone with pre-diabetes, you know, I talk to them about the opportunity of turning that around. I say to them that progressing to diabetes is, you know, not the expectation. I expect them to normalize it. And what's causing this is ultra processed foods, people eating too much sugar, and people having too much carbohydrate. So now that we know the cause of the problem, it's generally reasonably simple to turn that around and for people to normalize their HbA1c and no longer be pre-diabetic or diabetic. Now, that's saving the country a whole heap of money. The first Price Waterhouse Coopers report on the cost of diabetes in New Zealand, you know, I worked out that each diabetic reversed would save per year $3,330. So when I worked it out at the time, the intervention that those people had made was saving New Zealand about $250,000 per year. Now, there's more recently been another Price Waterhouse Coopers report, and it was working out now at around $9,000 per annum per diabetic. So when I worked it out at that stage, it was about $1 million per year being saved. Now, the point about this is it has cost the government not a single cent. This is people who have changed their diet to reverse their diabetes. And in fact, it's probably saved a whole heap more than that because people have been able to stop their medication. You know, so what I ask is, if it's not costing the government a single cent for this to happen, and just the efforts of, you know, people in the town of Taupo, is saving $1 million, but not just that, saving blindness, saving limb amputation, preventing strokes, preventing heart attacks, preventing cancers, preventing Alzheimer's, then why is not every health professional in the country advising their clients to do this? And in fact, not just the country, but throughout the world. Why is this so slow to catch on, when it clearly is effective, when there is no negatives? People just feel better, they have more energy, they sleep better, and their health improves, and it saves money, and we stop prescribing medications that are making people feel worse because of side effects. Why is not every health professional in the country giving low carb, healthy fat, ketogenic, intermittent fasting advice to their clients with diabetes? And there's no hardship to this. People actually are able then to eat these foods which taste really, really good. So the taste of the food improves, people's general health improves, they come off their medications, it saves money. There is no downside to this whatsoever. So my challenge, if you're a health professional and you're watching this, then please learn about it and please consider giving every one of your diabetic and pre-diabetic clients this option. Now, if you are someone with pre-diabetes, then find a health professional that can help you to get onto keto or low carb so that you too can make this number bigger. So 138, why is this not, 1,380? Why is this not 10,380? Why is this not 138,000? All it is just returning and eating the way that we have for 3.5 million years. So that's my challenge to you if you're a health professional watching this video. Thank you.